Cookie, and I'm going to be your fitness coach for today. Today we are working on the lower back. I've had quite a few people connect with me and ask me for some strategies to help with lower back pain. So it is really important for all of us to understand that basically after the age of 40, 80% of our population experiences some type of lower back pain. Some of it is pervasive, and it can be very debilitating both physically and emotionally. So we want to make sure that we're doing what we can to mitigate it. Today I'm going to go through some stretching and mobility things for your back. I'm going to be doing it here on my massage table, but you can do this on your bed. You can do it on the floor. The reason I'm doing it up here is many people cannot get down on the floor, especially if they've got lower back stuff going on. Again, if it's an acute issue, you want to make sure that you're continuing to ice. After you've had it for a while, you can add heat in and then kind of add both ice and heat to help with the pain. Just understand the heat can be kind of a double-edged sword because the muscles in the back are very small in some instances, and when you add heat, what happens is it promotes a lot of blood flow, and so you can have where you're getting cramping and those kinds of things in the back, and obviously that's not what you want to have happen. So I always err on the side of ice as much as you can. I know it doesn't always feel really good. If you have access to get into a pool, that's great, and work some non-weight bearing kind of stretching and movements. So having said that, we're going to get started. All you're going to need for this section is a bed, or you can be on the floor, and I'm going to use a pillow a little bit. As we've talked about in other videos, if laying down does not feel good for you without a pillow, then I encourage you to use a pillow behind your head, no worries. So we're going to come down onto our backs, and the very first thing you're going to do is get comfortable, and I want you just to relax your body, let your arms come down by your side, and you're just going to rock across your lower back 10 times, 8, 7, 6, 5, 4, 3, 2, and 1. Now we're going to bring one leg up at a time and hold that leg in towards the rib cage. You're going to do that for 4 breaths. So I'm going to start with my left. I'm going to bring the inner edge of my inner thigh in towards my rib cage with both hands. Notice that I'm behind the knee, and I'm just pulling in and I'm breathing. I'm relaxing the shoulders. Inhale here. Exhale. That's 1. Inhale. Exhale 2. Inhale. Exhale 3, and you might be able to get a little deeper with each breath. Inhale and exhale 4. So let's release that. Let's do that on the other side. I'm going to bring my right leg up and I'll hold behind. I'm bringing again this inner thigh in towards my rib cage. I'm going to pull in and I'm going to breathe. Inhale, exhale 1, inhale, exhale 2, inhale, exhale 3. And my last one, inhale, exhale 4. And I'm going to release down. And let's rock across a little bit again, kind of stretching that out or just letting everything sift. So now what I want to do is do double legs. So there is a pose in yoga called Happy Baby. If you feel really super comfortable with that, you may use that. Otherwise, I'm going to kind of modify it. So I'm going to bring right and left legs up. I'm going to hold behind the knee. And again, I want to bring this inner thigh into my rib cage. Now let's say I'm here and I'm pretty flexible, I'm not feeling it. I can reach up and grab onto my shins and pull down, or I can reach up on the outside or the inside of my legs and pull down here. And my goal is, again, to keep the legs wide so that the thighs are on the outside of the ribs, and I'm just feeling the stretch. Now I'm going to feel this in my inner groins, I'm going to feel it in my outer hips, and in my lower back. And I'm on 3 breaths. Let's do 1 more. Nice. And on your next exhale, you're going to slowly release. Bring those legs back down. Good. So the next one I'm going to do is called the modified number 4. And the reason we're doing the modified is because some people, when we bring both legs up unsupported, it's a little stressful on the back. So I'm going to press into my right foot. I'm going to bring my left foot and cross my left ankle over my right knee. I'm going to take my left hand and push to open this hip. And I'm relaxing my left shoulders, and I'm just breathing here. Keep the abdominal wall connected. I'm just breathing. This is 2. Inhale, exhale, 3. And one more. Inhale, exhale, and 4. So this is modified number 4. I'm going to repeat it on the other side. Left foot comes down, right ankle crosses. I'm using my right hand to open up this right hip, relaxing my shoulder, keeping this core connected, and just breathing here, inhaling and exhaling. And depending how tight you are, you may feel this in the outer glute. You may feel it in the inner groin. Good. 2 more breaths. And 1 more breath. Now, if you're having, this is hard for you, you're going to repeat it again. If not, we're going to go ahead and crisscross this left foot over, bring my right leg up. So my right shin is parallel to the floor, and I'm pulling in. My left hand again is opening up. Now, sometimes you can reach back, my left arm can come underneath, and you can put your elbow in here as you pull in. Whatever works for you. But if you can't reach behind here, you're going to just push with one hand, put one hand on the back of the thigh, and open up this hip. So we're trying to open up this hip, keep this core engaged, relaxing your shoulders. You have 2 more full breaths. Good, and 1 more full breath. And we're going to switch sides. Left foot comes over. Again, my left shin is parallel to the floor. Option 1 is going to be pushing out with my right hand. Option 2, I can come behind and pull up and use my elbow to open up this knee, this right side. And what I'm thinking about in these stretches, y'all, is trying to get my tailbone down. Keeping that abdominal wall pulled in, relaxing the shoulders, and just keep the breath going. Observe all of your facial muscles move. Make sure that you're relaxed, you're not gritting your teeth, and just breathing. Good, you have 2 more. And 1 more. So this next one is a modified twist. I have my right leg, ankle, over my left knee. I'm just going to slide it like a lady sits, and I'm going to put my left foot on the floor. So I've got my legs pretty tightly connected here. I have my right leg on the top. I'm going to move over just a tad to my left, and both legs are going to go to the right. And I'm not going to force these legs. I just want gravity to help that work. So now, upper body, I'm going to reach the arms up. With an exhale, I'm going to bend the elbows and put my triceps on the bed, and then just let the arms open out wherever they go. And then think about opening through this chest, relaxing the shoulders. Now what we want to focus on, y'all, is breathing into this top rib cage, this left rib cage. I'm going to start to squeeze with my inner groin muscles. Take a breath in, and on my exhale, I'm going to see if I can move my left ribs more to the left as I'm squeezing the groin, and take my legs a little bit more to the right. So you're going to judge how much you want to work this depending on how this feels on your lower back. You're going to give me 2 more full breaths. Good. 1 more full breath. Nice. And then when you're ready, take a big breath in. Use your inner groin and your core to help you bring these legs back up. Nice. I'm going to uncross, and now my left crosses over. Squeezing in. I'm going to scooch myself a little bit to my right so I have room. Both legs are going to go to the left. So now I'm feeling this stretch all the way up through this right rib. I'm going to inhale the arms up, put that tricep on, open up those arms. And just feel the stretch, not only in this chest, but in this upper rib cage area. So I'm breathing in here. I'm squeezing with the inner groins. The groins are helping the legs go more left. The ribs are trying to go more right. And I'm just breathing here. Good. 3 more breaths. 2 more. Nice. And 1 more. Inhale here. Exhale, use your core and your groin to help you bring those legs back. uncross, and I just want you to rock it out a little bit right here. Very, very nice. Good. So we're going to go into what we call pelvic tilts, and this is kind of thinking about it like a cat and cow, but we're doing this absolutely laying flat on our backs. So from this position, what I want to do is inhale, create a slight arch in my lower back, rib cage kind of lifts, and if you think about having a big bowl here on your pelvis, and in that bowl there was liquid, okay? When we arch the pelvis, that liquid is going to pour out towards your feet, and when we flatten our back in towards the mattress or in towards your bed or the floor, that liquid is now going to pour towards your chest. Let's do 10 of those. Inhale, lengthen. Exhale, contract around. That's 2. Inhale, lengthen. Exhale, contract around. 3. Inhale. Exhale, 4. Inhale. Exhale, 5. Inhale to lengthen. Exhale, contracting around. 6 and 7. Inhaling. Exhaling. 8 and 9. We're going to do one more, and 10. Very nice. So now what we're going to do is we're going to add some bridging. So we're going to be putting weight into our feet. We're going to articulate up to a bridge, articulate down. We're going to do 10 of those, and then we're going to power up without articulating for 10. So let's do those first. From this position, I'm going to go ahead and take this pillow out, and I'm going to put it over here for just a second, because it feels better for me to have my head flat when I bridge rather than putting a little strain on my neck. So from this position, again, I'm going to pull back from my navel, flatten my back into the mattress, and peel up into a bridge right here. Big breath in, and then from your upper back, I want you to peel back down. Beautiful. Inhale at the bottom, slight arch. Exhale, flatten your spine, peeling up. This is 2, and slowly lower. Inhale at the bottom, exhale, peel and lift. Inhale here, exhale, peel and lower. Inhale, exhale, peel and lift. Inhale at the top, exhale, peel and lower. I think that's 5. We have 5 more here. Inhale, exhale, peel and lift. Inhale, exhale, peel and lower. That's 6. Inhale, exhale, peel and lift. Inhale, exhale, peel and lower. That's 7. Inhale, exhale, peel and lift. Inhale, exhale. That's 8. You have 2 more, y'all. Inhale, exhale. Inhale, exhale. And last one. Peel it up. Big breath at the top. And peel back down. And just rock across your back a little bit. So now we're going to do the same thing, but instead of articulating, you're just going to lift from the hip socket and lower. So here we go. Inhale here. I'm pulling in the abdominal wall. My ribs are getting closer to my hip. I'm getting that transverse abdominis connected. On the exhale from your hip socket, lift. Inhale, exhale, lower. 1. Inhale, exhale, lift. And 2. Inhale, exhale, lift. And 3. Inhale, exhale, lift. And 4. So this is part of the strengthening. Inhale, exhale, lift. This is 5. Inhale, exhale, lift. 6. Inhale, exhale, lift. And 7. Inhale, exhale, up. And 8. Notice that I'm not thrusting very hard through the pelvis so that I'm jamming the back at all. It's a very gentle lift. And 9. We have 1 more. And 10. So we're going to add 1 more bridge. We're going to add this pillow in, and what you're going to do is, as you get to the top, I want you to hug your pillow, and when you come down, you're going to relax. So I'm going to grab my pillow. I'm going to stick it right here between my inner thighs. I'm back to the beginning. Inhale to prepare. As I come up, I'm going to squeeze the pillow, and then relax as I come down. Squeeze and lift. Relax as you come down. Squeeze and lift, that's 3, relax. Squeeze and lift, that's 4. Squeeze and lift, this is 5. Squeeze and lift, 6. Squeeze and lift, 7. Squeeze and lift, 8, you're almost there. Squeeze and lift. 9, you have una más. One more, y'all. Squeeze and lift. And 10, nice job. I'm going to take that pillow out, slide it behind my head again, and rock across that lower back. Just go, ah. We're going to also bring these knees back up. Remember this stretch from earlier, here, here, or here, just stretching out that lower back. Let's do 4 full breaths. Inhale, exhale. Inhale, you guys are doing great. And exhale. And last one, inhale, and exhale, and release. Good job. Okay. So now what we're going to do is we're going to do a little core work, very basic, and work it up. These are kind of, again, conditioning exercises for abdominal wall. So many times with our lower back, one of our problems is our abdominals are weak, and so is our lower back area. So these exercises are designed to work, the bridging was working the back side of the body, and the core that we're working right now is going to work the front side of the body. So from this position, I want you just to press your arms down into your mattress and make sure the whole back of your arm is active. I'm pushing down, my chest is lifting a little bit, so the arms are active, and I'm going to engage the core. I'm going to just lift my right leg up, and we call this position tabletop, where your shin is parallel to the ground, and I'm going to lower it down. We're going to do that 5 times. Lift it up and lower. Lift it up and lower. That's 3. Lift it up and lower. And what I want you to do is keep pulling on this abdominal wall so that your back does not go into an arch. You're just maintaining this nice level pelvis. So we talked about the bowl with the liquid. The liquid right now is straight in the middle. It's not pouring either direction. Press into the right. Let's lift the left for 5. Lower down. Inhale, exhale, 4. Keep pulling in here. Inhale, exhale, 3. And 2. And 1. So now what we're going to do is we're going to alternate, but I don't want you lifting the opposite leg up until the one that's been up is already down. So I'm going to press left, lift right, lower right, press right, lift left. Inhaling and exhaling. Good. Keep that breath going. Keep pulling in. We're doing 10 of these. So you'll be doing 5 on each side. This is set 3. Keep pulling in. Good. This is set 4. Keep pulling back from that core. And inhale, exhale, 5. Good. This is set 5. Good. Number 6. You should start to feel this work in this lower area in the abdominal. We don't really have lower abs, but you're just going to feel the work, hopefully in the transverse abdominis. Good. This is your last set, y'all. Nice. Beautiful. And rest. And you're just going to relax and rock across that back again. Very nice. Okay. So this next exercise we're going to do is, again, a core stabilizer. We're working up to an exercise called the dead bug, but we want to get there where you're feeling like you're connected in the core. So now we're going to bring both feet off the floor into that tabletop position. Beautiful. And I'm going to keep pulling back from my belly, and my arms are going to stay right here. All I want you to do, keep pulling up from your belly, is you're going to tap the right foot, lift it, tap left. Lift it and right. Lift it and left. And 4, inhale and lower. 5. We're going to do 10. This is 6 and 7 and 8, 9 and 10. Good. Bring your knees in. Rock across your back. Beautiful. So this next one, we're going to do the same exact thing, but we're going to add some arms. It's going to test your coordination, which is always good. Bringing these legs back to that tabletop. I want you to bring your arms up. So all the arms are going to do is slightly go over your head and come back up. Slightly over your head and come back up. Give me 2 more just like that. Good. 1 more. Nice. Stop at the top. So as my right toes touch, my arms go over and I bring them back up and left. And up. And right. And up. And left. Keep pulling back from that abdominal wall. Inhale. Exhale. Inhale. Exhale. Good. 3 more. Good. 2 to go. Good. This is your last set here. Good. Last one. Bring those knees in. Stretch your back. Kind of rock it out. Okay, so now we're going to change the lever a little bit. We're going to bring those legs out, pull in. This time want your arms down. Your leg is going to extend at a diagonal, and then we're going to switch, okay? So let's do 10 of those. Ready? Inhale, keep this connection. Exhale, give me 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bend your knees, come in. So let's add those arms back and forth with that. Arms are going to go just back and forth. So bring everything up. Right leg is going to go forward as the arms go back. And now switch on the left. Ready? Front left, right, left, right. Inhale, exhale. Give me 5 and 4 and 3 and 2 and 1. Bend those knees, come in. Nice job. All right, we're going to mix it up. Last set, you all, on this one. Arms are up. Good. Now, bring your legs up. When my right leg goes forward, my left arm is going to go back. And then I'm switching. And my arms are just in opposition. Give me 10, 9, 8, 7, 6, 5, 4 to go. 3, 2, and 1. Bend those knees, rock around on your back and go, oh, very, very nice. Breathe. Okay, I'm going to go ahead and rock up to a seated position. There's a stretch I wanted to show you. It can be a little difficult. We're going to give it a try up here. I know that my massage table is a little higher than a normal bed, so that's what makes this one a little bit tricky. So you're going to give it a try. Hopefully it'll work if your bed's a little higher, or if you had a higher surface. This is one you cannot do on the floor. The hip flexors is a little bit of a challenge to stretch for most of us. So what we're going to be doing, I'm going to come forward on this massage table, and my right glute is almost off this table. So I'm going to let this leg hang down, and my goal is to kind of reach towards the floor till I feel this stretch right in this hip flexor. So from this position, I'm going to bring my opposite leg up, my left leg, and I'm going to reach behind the knee, and I'm just pulling this left leg up as I'm trying to reach this right leg down. And I'm really relaxed first. I'm just going to let it relax down, kind of feel the stretch. And now I'm going to really actively try to push that leg down. And I'm just breathing here, inhaling and exhaling. Good, give me 2 more full breaths. 1 more full breath. Nice. So then to come out of this, I'm going to go ahead and relax, take a breath in. I'm going to use my core, and I'm going to reach down with my hand of the same leg to help lift this leg back up. I'm going to come up and just kind of rock off on the lower back. And now I'm going to rock up and switch sides so you guys can see again. And I'm just going to pivot myself this way. So now my left butt's kind of hanging off. I'm leaving my left foot reach towards the floor till I feel the stretch here. I'm going to bring my opposite leg up and pull in. Try to relax your head and neck here. And I'm just letting gravity work on this leg. Now I'm actively trying to push my left toes towards the floor and breathe. Nice. You have 2 more breaths. 1 more breath. Awesome. And I'm going to reach down, grab onto my left leg, pull it up, and both knees in, rock a little bit. And then I'm going to come up and come onto my hands and knees. Woo. All right, you're on your hands and knees. We want to make sure that your wrist, elbow, and shoulder are in one line. Your hip and your knee are in one line. And we're just going to go through cat and cow here. So I'm going to take the tailbone up, soften in the shoulders as I look up, and then tuck the pelvis under as I round. Inhale, lengthening, look up. Exhale, contracting round. Give me 2 more. Inhale, lengthen, look up. Exhale, contracting round. And one more time, y'all. Good. Now, the last thing we're going to do up here is the dead bug now on your front. And I'm going to move my pillow out of the way. So I'm not kicking it. Okay? I'm actually going to put it over here. Okay. So I want you to think about pulling up from this abdominal wall and staying very connected. So let's just work the legs first. You're going to shift into your left leg, reach your right leg up, flex that foot, and try not to let this hip open. Keep your hip closed, toe points down. And then you're going to bend out, shift right, lift left. Good. It's going to be a little more difficult, you guys, on your bed because the bed is very soft. So just be aware it's going to be a little more challenging. And then release. So now shift into your left hand, reach your right arm. Lower right, shift right, lift your left. Good. So now we're going to put that together. You're going to be lifting your right hand and your left leg at the same time and flexing and pulling in and holding. And now I want you to bring your knee in and reach it out. Let's do 8 and 7 and 6 and 5 and 4 and 3 and 2 and 1 and release. Good job. Let's try the other side. I'm going to shift. So now my left arm and my right leg. I'm shifting and lifting. Hold. And then pull in. Let's do 8 and 7. Inhale, exhale. 6 and 5, 4, 3, 2, and 1. And come back. Let's add a couple cat and cows here just to finish out. Let's do 3 more. 2 to go. And 1 more. And go. Oh. So that is your back series 1. We'll continue to add to this. I hope that this really helps you. Remember to take care of yourself. Be aware of what you're doing on a daily basis. We want to strengthen the areas that are weak. We want to stretch the areas that are tight. And we want to mitigate as much of our stress as we can. You all be safe. Have a wonderful rest of your day. Namaste. Take care. Bye-bye.